Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. You know, there's a condition that you hear a lot of women speak about. I even heard it in my own family, even from a child, of the condition called fibroids. Fibroids, you know, these are tumors of the uterus and so forth. So many women have it, and so many hysterectomies. When they say hysterectomy, that means removal of the whole uterus sometime because you can't do anything else about it and things like this. And sometimes a woman might begin to have abnormal bleeding from the uterus, and that's an indication sometimes that's due to fibroids. But what we want to do today is talk about fibroids and really what's the cause of them, if there is a cause, and what we should consider to do about them if there's anything other than surgery. So we have Dr. Maharishi to be with us today. Dr. Maharishi, give me just a little bit about your background. I know a whole lot, but the people looking at this show don't. A little about your training and what field you're in.
My full name is S.U.N.Y. Delale. I'm a gynecologist and reproductive endocrinologist, infertility specialist.
Right.
And associate professor at Downstate Medical Center.
Right.
And I see a lot of patients who's suffering from uterine fibroids, and they consult me with difficult cases for management and advice.
Right.
And because of that, and I became very interested in this topics and conditions, and I do some research and to see what causes, if we can find the cause, and treatment.
All right. But you know, so many of women really don't know what a fibroid is. The general audience, maybe you could just give a description what the fibroid is and what symptoms they might consider if they have a fibroid.
Okay. Fibroid is benign growth of the uterine muscle, some people call it myoma. And it can grow in the cavity, in the inside of the uterus, in the muscle itself, or on top of the uterus.
All right.
And can be single one, or can rise in the uterus and grow the uterus up to the xiphoid.
Oh, yes.
And it could be multiple, and we don't know what caused it.
Right, yes.
And there is some high risk factor, like young age getting their first period. We call it menarche, first period, puberty, entering puberty, very young age. And overweight.
Right.
And of course, it's so common that by age 50, black women, almost more than 80% develop fibroids.
Oh.
In white is 70. But in the black woman, unfortunately, develop very young age, multiple and larger size, and they get more complications than the white females.
Right. When you say complications, what would we say sometimes? For example, I had a patient come in and she thought she was pregnant. And she wasn't pregnant. She had a fibroid that large.
Yes.
In fact, it was big as a basketball, the fibroid. And she was a young African-American woman as such. But maybe concentrate on that a bit, why the African-American woman might have more of it.
We don't know why, but it could be genetic, it could be other environmental factor, but they develop at younger age.
Younger
and
age.
They
when you say younger age, what?
Like right puberty, after puberty, young, very young. Like let's say by age 35, 60% will have, black women will have fibroids.
I see.
But in the white one, only 40%.
I see.
Less.
I see.
And they have more symptoms like pressures because of they are larger.
Surely.
And then they have end up having more surgery procedure because of that.
I see.
And they have more adhesion in around the uterus during surgery
Oh, okay.
than white. And then because of that, they end up more complications.
When you say adhesions,
It's
during
scarring
the tissue.
tissues sticking each other.
I see.
And it's more in common in black than white. And because of size and all the adhesions, and when they have surgery, they have more complication, more blood transfusions than white.
Well, you know, when you talk about the fibroid, I look at sometimes the skin, for example, when people have a keloid.
Mm-hmm.
African Americans with keloids, just from a simple scar, get a large keloid, which is the same kind of growth type of thing that you're speaking about in the uterus.
Right, it's like, and actually in NIH they show that has similar mechanism, and patients with keloids have more fibroids than non-keloid women.
Is that right?
Yes.
Well, that's interesting. You know,
Yes.
and I hadn't thought of this before, only from the discussion with you right now.
Mm-hmm.
And you talk about this muscular growth
Yes.
that can be inside the uterus, in the wall of the uterus, or
and
outside of the uterus. And what percentage of these people, let's say African American women, could expect maybe to form fibroids?
Up to, see, as I told you before, by age 35, 60%, by age 50, more than 80%.
Any proportion of these people obese? Does obesity have anything?
One of the risk factors is obesity and overweight.
Overweight, okay. Yes. Now, what would be a presenting sign of a fibroid? I mean, uterine bleeding, or that would lead to surgery, for example?
Okay, majority of the patient will not have symptoms.
Okay, I see.
And like 20-30% will have symptoms like abnormal bleeding,
Right.
pressure, frequency urinations, and back pain, and they might feel the growth themselves.
Yes, right.
Some of them, they so big, lady comes, tells us, well, people think that I'm pregnant.
Oh, I see, okay.
I'm so embarrassed
Yes.
to tell them that I'm not pregnant.
Right.
And
Is there a difference in the production of these fibroids from Africa to the African American woman? Say in Africa, is there a larger percentage of women in Africa have fibroids, or is it the same in the African, or say West Indian, or the breakdown?
that's excellent question, Dr. Deas. You know, actually a lot of physicians and scientists wants to know if the fibroids incidences in Africa is different than in the United States in black populations.
Right, yes.
I don't have the answer really.
Right,
Possible is different, but we don't know.
yes.
It's-
yes.
Possible is different.
Right.
But that will tell us whether or not environmental factor is contributing to fibroid here than in Africa.
Right.
But I have to tell you, even Africa now is not the same. They are changing.
Right.
They are adopting the Western lifestyle.
Lifestyle,
And
surely.
that's why it's not the same anymore.
Okay, all right.
You understand?
Yes, oh sure. Has there been any relationship between, say, drinking alcohol, like you mentioned before about the fetal effects of alcohol and so forth? Is there any history of alcoholism in this?
Alcohol, and especially beer, and maybe more meat, and it's not smoking. Coffee intake, 3 cups and more coffee intakes, and might be associated with fibroids.
Well, that's very interesting. Because, you know, coffee has now taken over our pleasant hours where people go and get the best cup of coffee they can get.
And large size.
Large size. And have no idea that this might be one of the things that we have to educate people about, that if they have a more propensity of getting a fibroid because of their native background, that we have to warn them way ahead of time. Because how many operations are formed by fibroid operations?
Well, 600,000 operation hysterectomy is done yearly in United States for uterus, removal of uterus.
Right.
But majority is due to fibroid.
600,000, you say 600,000?
Per year.
You're not saying 600.
600,000.
600,000.
Yes.
That must put gynecologists a lot of operating room time.
Right. But
Yeah.
not all of them due to fibroid.
Right.
But majority is due to fibroid. Some of them abnormal bleeding that cannot be controlled
Right.
with medically. Some of them infertility. Some
Yeah.
of them due to endometriosis.
Right. Well, now, when you think of the diet of the African American woman, say with meat, say smoked products, for example, smoked bacon, smoked sausage, smoked pig, everything from the snout to the tail. Does that have any relationship, do you think, when you said meat before, or the processing of meat?
Well, we don't have good study addressing that. Only one study suggesting possible meat
Okay.
and lack of vegetable and fruit in their diet.
I see. The American Indian, is there any relationship of their?
Okay. Actually, it's more dark skin color.
Okay.
Women have more fibroids than white.
So melanin might be
Maybe-
playing a role.
maybe.
Okay. You see, a lot of these things are not brought up in the prevention as young girls are growing and things like this. And so if everything is based upon getting the disease and operating on the disease, there's no reason to not study it a little more closely, the population, what they're doing to cause this, you know.
Even though it's so common disease,
I know.
really we don't know what causes for it.
Sure.
And that's why really we need to do more studies
Yes, you're right.
to understand it.
Sure.
And this way we can maybe help these women without going through extensive surgery and treatment and complications and suffering a lot because of this condition.
You know, I know you're an expert in your most famous field is endometriosis. Just give a brief description of endometriosis so the audience can see what that...
Endometriosis is the lining of the uterus inside is grow outside the uterus.
Okay.
And then respond to female hormone, and they do cause cyst, adhesion, and bleeding when they have periods.
Yes.
Inside the uterus.
Right.
And cause inflammation inside.
Right.
And women suffer from pain and with period, without period, difficulty having sex, and infertility.
Right. And what percentage of African American women can say are liable for endometriosis?
Actually, every woman is equally involved with this. In the past, they were saying that mostly white women.
Yes, right.
Because white women used to get diagnosis early.
I see.
And actually, all over the world, that there is considers there is delay in diagnosis endometriosis.
Oh, I see.
And 7 to 12 years there is delay in diagnosing it. And a woman, because they think that is some in a group, ethnic group, they think it's normal to have painful period.
Right.
And that you should bear it. And the young girls told that it's normal. You should not complain, and that's the things which is not normal.
Right.
And to have a lot of pain during period.
Right.
And even teenager who has a lot of pain, does not respond to normally pain medication and birth control pain, up to 70% of the time they might have endometriosis.
Now, with the legalization of marijuana, for example, do you think there could be any relationship between even marijuana or any other drug leading to fibroids, other than just diet? Anything that, when you say 600,000 hysterectomies a year, that's a big medical bill. Mm-hmm. That's a big medical bill.
Right.
I mean, I can't understand why the scientists can't see that. I think more people have that than cancer.
Definitely.
and it costs much more.
Yes, definitely. It costs a lot of expense and suffering.
And suffering, yes.
And we hope that one day that we'll have soon we find the cause,
right,
and we find simple way to prevent it and treat it.
Right. Does birth control pills, has the introduction of the birth control pill, is there any relationship of the introduction of the birth control pill and the increase in number, say, of patients who might get fibroids?
Not really. I don't think there is a connection.
Right.
But we have to look into that more in detail. But I don't think there is increase in birth control pill and things. But women who had young age kids, many kids, their pregnancy and delivery, fibroids incidence is less.
It's less.
And then after surgery, if they got pregnant, then with fibroids coming back again, it's less.
I see. What do you think the future of fibroids, of treating fibroids, other surgery? What is the most common surgery do they do for fibroids?
If depend on patient desire.
I see.
Whether or not they have kids that they want to have children.
No more children.
Or they are close to menopause.
Right.
And their severity of the symptoms.
Right.
And they're like severely anemic.
Right.
Or they have a lot of discomfort.
Right, yes.
Pressure, all these things. And urinary symptoms, bowel symptoms. And depend on these. If they don't have symptoms,
right,
they don't have to have any treatment.
Okay.
You just can observe them.
Right, surely.
You don't have to operate. You don't have to give them treatment.
Right.
Just observe.
Right.
And they might grow slowly. They might stay same.
I see.
Majority after menopause, they shrink unless they have put on hormone replacement therapy.
Oh, I see.
It's fibroids, estrogen, and progesterone dependent tumor. Mm-hmm. As long as they are menstruating, they have estrogen, progesterone.
Right.
They respond to that.
Yes.
And when they go to menopause, they shrink.
Right. Oh, I see.
Actually, fibroids shrink many years before menopause.
I see.
But black, until menopause, they continue to grow.
I see.
After menopause, they start to shrink.
They start to shrink.
Yes.
You know, because women are offered total hysterectomies where they take the ovaries and the whole uterus out. Mm-hmm. And they'll say, clean me out.
Yeah, they do want to clean out, but they don't have to have ovary taken out.
Right, surely.
They can have uterus only.
Right.
If they are trying to have kids, they can only fibroids taken out.
Right, surely.
And now there is other modalities now. Uterine artery embolization, more minimal procedure.
I see.
MRI guidance, focus ultrasound, heating of fibroids and shrinking fibroids.
Oh, okay.
And there is other modality is coming, but hopefully there is medical treatment. They are short-term.
Right.
They are not long-term medical treatments. And they might get birth control pill to control abnormal bleeding.
Right, surely.
And medication for abnormal bleedings.
Right, surely.
Was not cure for fibroids.
So your suggestion is that women should not run right away and just say, clean me out as such. Take my ovaries, take my uterus, and I'll be all right.
Yes, they can to find out whether or not their symptom is due to fibroids.
That's
because
right,
they
sure.
are so common. Not even abnormal bleeding is not due to always fibroids.
Okay, all
and
right.
could be hormonal, could be other things, and that's why they have to be investigated to see if this is due to fibroids.
All right, sure.
And infertility, most people think fibroids cause infertility. Actually, 1 to 3% of infertility due to fibroids.
Right.
Mostly it's different.
I see.
It's causes, and that's why they need to get complete investigation to see if they're really truly fibroids causing their infertility.
Yes, right, yes. You know, this discussion just brings up so many things in medicine that the average physician is not aware of. You know, they'll send a person right off to a gynecologist, and rightfully so, they should send them to a gynecologist, but somebody like yourself who can give what the whole history of these things are and what choices they have other than going to have a hysterectomy or what have you. Mm-hmm. You know.
They don't have to have a right away hysterectomy.
Right.
And actually they can be observed.
Yes.
Watched.
Right.
And if they have symptoms, bleeding or infertility, you have to have an investigation to see if it's really due to fibroid.
Right, surely.
They might have other causes, and you might treat the other causes, and they don't have to have surgery.
Right. Now, you've been the head of this department here. Do you train the average physician while they're in medical school or in their residencies? Do they have these lectures that you're giving me today?
Yes, they come to my clinic,
All right.
and they see that how I treat them, how I counsel them.
Right.
Majority of my time is really counseling patients.
Well, you know, that's wonderful because Downstate, you know, sits here right in a community where there's African American predominance people who are suffering from these conditions. And to have a person like yourself at Downstate, right? Downstate Medical Center should be, in quotes, the place to come to get the right decision before they have any decision made on surgery even, you know. And so are you open? Do you have a number that they could call to even make an appointment?
They can call 718-270-2101.
Yes.
And we're doing research too on fibroids.
All right.
And if they are interested in research, and they should call 718-270-1364.
All right. Well, this will be on the bottom of our screen. But it is such a pleasure having a refresher, even course for myself to listen to you about some disease that's really very prevalent. And when you talk about I have to keep saying that, 600,000 surgeries for hysterectomies, that seems I don't know any other medical condition, surgical condition that has that many operations, except say for cancer maybe or something like that.
Not really.
That's right, you know. Right. So the future is what? What's the future of you even being around with us here?
Well, we need to do more research and to find out the cause and causes of these conditions, and we have to have other modalities that we can give the patients that non-invasive and without a lot of side effects.
Right. Yes.
And maybe, hopefully, in the future, cheaper.
Well, I would only say that in closing, that this is a magnificent discussion with you today, and I'm sure the audience that's looking at this seeing an expert who's been a lot of her life in doing these kind of things for this condition, to be here, to be with us, to be right here at Downstate.
Thank you very much,
to
Dr.
take care
Deas.
of us, you know.
Thank you.
So you folks out there, if you thought you're going to have a operation or a hysterectomy or anything like that, prior to making that decision, you might want to get expert advice, because basically there are other things that take care of things. It's not just medicine all the time or surgery all the time. But this body is a very complicated thing. Just as our friend doctor here was talking about smoking or taking drugs or any other things that you might get involved in as a teenager might determine whether you might have to face this kind of surgery someday. So here, join us the next time. We hope to enlighten your mind. See you the next time.